tonight. I'll talk for maybe 15 or 20 minutes, if that's okay, Brian.
Yeah, that sounds good.
And then I can take some questions from the crowd if needed, or you guys can send out my email in the chat screen if anyone wants to get in touch with me via email or has problems that you want to talk about or anything like that. As I put together notes on back pain, I think there's a lot of important things about back pain to know that include prevention, what to do when you get pain and have pain, maybe when to seek out some imaging for your pain, and what to do about it when your pain is there and you're not quite sure what to do. So we'll talk about some of the things about back pain that I think are really important to discuss, especially as we get into our 40s and 50s and 60s and potentially 70s. It's important to know some of these things that maybe you've had some x-rays or MRIs before and what those kind of things mean. And I wrote a blog about this for Brian maybe 4 or 5 years ago, the Busting Myths on Bulging Disc post that I wrote a few years back. And is that a lot of findings that we would see in someone who is 40 or 50 or 60 or 70 are potentially considered age-related findings, that they are normal in the sense of everyone ages, we get wrinkles in our skin, our discs degenerate a little bit, maybe degenerate is the best word for it. We get a little bit of arthritis, and those things are completely normal. Most of the studies in imaging that show those findings themselves are found in completely asymptomatic people. So people join these studies, they get images of their spine or their knees or their shoulders, and they have multiple radiologists read them. And there are studies that show, 50, 60, 70% of people that are normal without pain have some of these abnormal findings or pathological findings. And they don't necessarily mean a whole lot to someone's particular presentation. Some interesting facts. There's a study that just came out about 6 months ago in knees in particular, but the average age of the participant was 44, and 97% of the asymptomatic patients or the clients in this particular study had abnormal findings, whether it was a meniscal tear or ligament damage or arthritis or patellofemoral compartment arthritis. And studies show this in the shoulder, that upwards of 70% of people in their 50s have labral tears in their shoulders. I see it all the time. I see a lot of shoulder patients, and I see rotator cuff tears that are pretty common. And you see them in the opposite shoulder as well when they're in your clinic and they have all the same findings on the other side. They're just not painful. With back specifically, the prevalence of disc degeneration in asymptomatic people at age of 20 was 37%. So almost 40% of 20-year-olds are going to have signs of disc degeneration, which is something that shows up on x-rays a lot. As we get into our year 70s and 80s, 96% of people will have those findings. Disc bulges is something that people talk about a lot. At 20 years of age, 35%, and over 80% of people that are 80. And those injuries that kind of seem worse, discs, sorry about that. Disc bulges, disc protrusions, and disc annular tears, disc herniations. Those things are prevalent in age-specific people from 20 all the way up to 80, and those people don't have pain at all. So that's something that is important to know, that if you end up with back pain and your doctor sends you for an x-ray or sends you for an MRI, that those findings should be read with a little bit of a grain of salt. And they don't necessarily mean that your case is particularly difficult or problematic, or that you're gonna have a more difficult time getting through this pain episode that you're having. A couple other things that should be noted with back pain specifically, and a couple myths that are out there, is that one myth is that pain only can occur when you're injured, and that's not true. Injury doesn't have to be present for pain to be present. Pain is very much a brain response. So what you feel in your back, whether it's pressure or whether it's temperature or whether you have inflammation, is a signal that gets sent to the brain, which the brain scrambles up and sends back down and perceives it as a threat. So that response down to your back is back pain. And that pain response is in general so that you will stop whatever it is you're doing to try to prevent yourself from getting worse. But that input is not a pain input. It's something else. Like I said, it's pressure, temperature, chemicals, something like that. the timing and the intensity of pain do not always match the severity of pain. So we get people with back pain x-rays all the time, and you look at their x-ray and it looks pretty clean, but they're sitting on your table and they can barely move. They don't have a significant amount of arthritis, they don't have any significant findings, and they can barely move when they're on the table. This is what I see in a lot of kind of desk going people when they're weekend warriors or they go to the gym, they lock up in their back. They come to you and they can barely move when they get to you. It can be pretty challenging to work with, but you look at their x-rays, you look at their MRIs, and there's nothing that's really of note or what you think is going on here. Worse injuries do not mean worse pain. And you can injure something without ever knowing it as well. Think of a bruise. We've all bumped a table, got a bruise, saw it 4 days later and never know where it came from. That bruise is technically an injured tissue, but it never really hurt. You never even know how you got it. Another rumor, we already chatted about this, but the body tells the brain when you're in pain. That's just not true. The body tells your brain something, your brain scrambles that message, and the brain decides whether that message is bad or not. Say you've had pain and you get to the level where it becomes chronic. You've had pain for 6 months, you've had pain for a year, you've had pain for 5 years. Chronic pain doesn't mean that your injury hasn't healed properly. A lot of times we see that the injury has healed plenty well. The nervous system becomes really sensitive. Think about your Ring doorbell that rings all the time, every time a leaf blows by your front door. Prior to your injury, it was like having a normal doorbell. It only really showed up when people rang it. Now you put this Ring doorbell on, and every single thing that goes by your front door, whether it's an animal or a cat or a leaf or a flower blowing by, rings into your phone or rings into your watch to let you know that something's there. Your brain and your nervous system becomes very, very sensitive to what is going on. So now, something that used to not make any sense at all, like I could touch you with 1 pound of pressure, you never would have noticed that before. Once you've had pain for a while, I can touch you with that 1 pound of pressure, and all of a sudden it really hurts. It causes you pain, it causes you an emotional experience, whatever it might be. So the longer you're in pain, the more likely it is that your brain will become sensitive, that your nervous system will become sensitive to that process. And it acts like an early warning system when there doesn't need to be any sort of warning. So when you have back pain, another few things that are important to know is that sitting postures, a lot of us that work at a desk, not myself particularly, but if I get a patient that cancels and I'm at my desk for an hour, you don't necessarily need to worry that much about your sitting posture. Everyone worries about their posture a lot in this setting. And more importantly is that you're probably just getting up and moving a little bit more frequently at that time. With bad postures aren't necessarily super correlated with back pain or not being able to get through back pain. And so you don't necessarily need to worry about that so much, but certainly getting up, moving around, staying active, getting a cup of water whenever you feel like you need to move, especially in that acute episode of back pain. Sometimes you can only sit for 15 or 20 minutes before you feel like you need to move. So know that the position you're sitting in isn't incredibly difficult on your system. It's not going to injure you. It's not going to tear a muscle. It's not going to stretch ligaments. It just is. As long as you get up and move fairly frequently, and that might change depending on, what part of the pain you're in or what stage of the chronicity that you're in. Maybe you have to take a little bit more frequent rest breaks from sitting. If you sitting rest breaks, get up and move. As far as things that can predict back pain, Stuart McGill, I know Brian's really familiar with Stuart McGill's work. He did a lot of good work on low backs in the 90s and 2000s, and still pumping on a little bit, but not as much. Most of his students are doing the work now. But he put together a list of trunk endurance exercises. And I know Brian follows the McGill stuff, and he uses the stir the pots and things like that. That might sound familiar to each of you that do participate in his workouts. But he correlated back pain and people who have back pain and people who end up getting back pain with poor trunk endurance. People who you basically did a side plank, basically an isometric sit-up and an isometric back extension, and those who could hold those positions the longest seemed to be the ones that didn't get back pain at all. So what that tells me is that if you haven't had back pain or you don't have back pain currently, Those are things we can work on that might be able to help prevent back pain from ever coming up in the first place.
Greg, can I
Again,
jump in here real quick?
Yeah, absolutely.
So I think for us, outside of the lab setting and outside of, muscle testing and stir the pot and all that, I think what that looks like is, let's say you have a pile of mulch in your driveway and you go and you have a few minutes. So you go out and you take a couple shovelfuls or a couple wheelbarrows full of mulch and you spread it, and then you got to go back inside. You won't notice much back pain and you won't have much of a stiffness issue with that. But the longer you go and, the more your legs start to tire out, the more your core starts to tire out, like that core endurance that we mentioned, or that Greg mentioned, that's when things start to get worse. That's where the tightness comes from. And so it's a great point that, endurance is kind of everything. You can do a lot of things, but when you start to do lots of reps, or if you start to go for extended periods of time, whether you're rowing or doing yard work or whatever it might be, that's when, you can brace for so many reps, but then after that, that's when things start to fall apart. Would that be fair?
Yeah, that sounds absolutely right. That sounds right. Like when I pick dandelions from my yard for 45 minutes straight, and I usually wake up the next morning like, man, that really wasn't a good thing for my spine. And that's a little bit more sissy than doing mulch all day for sure. So things you can do to help in those situations, right? You've mulched all day, your wake up's pretty sore and stiff the next day. If there is a position which you found yourself in a dominant position for that day, so let's say you're doing mulch, you're picking flowers, you're dandelion, whatever, the weeding, you're going to be more flexed for more period of time. So the longer you are flexed, say you're bending over in the garden and your spine is flexed for 30, 45, 60 minutes at a time, it would be good because that tissue will ultimately kind of stretch and adapt and all that stuff to come back the other way. So when you come in from that activity, you come inside, you lay on the floor, you get on your elbows and you just kind of rest for a little bit. You take that tissue that's been stretched to its tolerance load over the course of 30 or 60 minutes, and you bring it back into a more shortened position. And allows you to kind of recover from that as well.
Greg, we have a question from Julie. She asked if long torso versus short torso has any, is a factor at all in this.
Sure. Brian, is that a term that you use in the gym, Brian?
We don't.
Okay. I can't say that it's a term.
I'm like body type, just body type.
Oh, sure.
Different body types have, is one more susceptible to back injury or to the endurance, the core endurance?
Yeah, that's a good question. From a biomechanical standpoint, anything that's longer, say an arm or a leg or a torso, has a longer lever biomechanically. So within that kind of physics terminology, it has to work harder to maintain its structural integrity. Sure. So, and then that doesn't necessarily mean that maybe someone is more likely to get injured. It means that someone will have to work harder to, say, brace, or planks might be harder, or stir the pots might be more difficult, or back squats might be more difficult with those longer levers. But it doesn't necessarily make someone more susceptible to injury or pain. Feel okay with that? Perfect. So we talked about. So some things you can do when you do get your episode of back pain. Has everyone here ever had back pain, or has anyone here ever had back pain? Seems like it's probably a pretty common thing in the athletic type. Most of us, we wake up in the morning, we don't know what to do about it. We kind of move around slowly. We get around, hopefully it goes away in a few days, and most of the time it will. Like I said, most of the time you're not physically injuring yourself. You've kind of worked yourself to the point where your body wasn't able to handle it particularly well. And most back pain episodes will go away on their own pretty shortly. So if it doesn't go away within a few days, maybe it's time to start thinking about, what can I do for this? What can I do to make it go away? What do I need to think about? Do I need to go to the doctor? Do I need to go to my physician? Do I need any imaging? So Imaging is not necessarily required a lot of the time. The only time that I would really seek out imaging from a physician for an acute episode of back pain is probably if you have some numbness or tingling down the leg. Anything that's neurological in nature, you would probably want to get checked out. That means that the nerve itself has been irritated, whether it is through stretching or whether it is through an inflammatory condition, or if it's through something like a disc herniation. Those things are really, really important to get checked out before they get too bad. So if you have any sort of numbness or tingling, that's one of those situations where I would say, yeah, go to the doctor. Maybe even pursue the imaging sooner rather than later, because if you can rule out a disc injury versus something else, it certainly makes the case a little bit go more smoothly, go a little bit quicker if it's not a disc injury. So outside of that kind of neurological compromise, that numbness or tingling in the leg or down the back of your leg or into your buttock, do you need to seek out care right away? Probably not. Like I said, most pain episodes will go away on their own. The first day or two are usually the worst. So sometimes it's really hard to move. Sometimes it's really hard to roll around in bed, get up and around. So I use an assessment technique called a mechanical diagnosis technique. It's really just you moving in front of me, for lack of a better term, to show me how you move, how well you move, if what you do makes you better, makes you worse, makes you stay the same. And the most common portion for a lot of us, low back pain, is that we have a poor flexion tolerance. We sit at our desk too long. Everything's in front of us. We're doing yard work. We're sitting at our desks. We're sitting for long periods of time, whether it's in our car. In my family's case, we travel back to Pennsylvania quite a bit, or at your desk for 4 or 5 hours at a time, potentially through the day. So the first test I really use for that is a standing back bend. So you're just standing up, feet shoulder width apart, hands on your hips, and you bend backwards as far as you can. And we're looking for a symptom response in this situation. So when you have that pain, you stand up, you bend backwards 10 times, even if it hurts. And we're looking to see over the course of those 10 reps, does that pain get better? Does that pain get worse? Or does that pain stay the same? And from that point on, you can kind of move through the process. So if that pain gets better within those 10 or 15 reps that you complete the first time, we have a pretty good idea that and then this is a term that we use in the diagnosis treatment, is the direction of preference. So our spine likes to move backwards in that situation or into extension. We can use that as our treatment. So we can do it standing. We can lie on the ground and do a push-up position and bend backwards into like a cobra type yoga pose. And that could be our treatment philosophy for your particular round of back pain. If standing and bending backwards is maybe a little bit too sharp for you, then we lie on your stomach and we do the same thing, but a little bit more passively. We use our arms in that push-up position and we push away from the ground into that cobra pose. Again, we do that about 10 times and we see what our symptom response is. So if that pain gets better over the course of those 10 repetitions, we know that your body likes that position a little bit more than being flexed while sitting at your desk or bending forward a little bit more. So that's going to be your first treatment philosophy. We use that. We can do it throughout the day as many times as you feel like you need to. It can break up the monotony of sitting at your desk. And it's something that's really, really, really easy to do kind of throughout the day when we take those rest breaks away from sitting.
Greg, I feel like that's something that a lot of people like, that prone extension position. That's something that is prescribed for a lot of people who have back pain. Is that just is it coincidence? Am I just seeing that, or is that the case for most and that's something they could do on their own? Is do
Sure.
some of those extension exercises?
Yeah, I think it's a really good starting place for self-treatment. Sure. I'm not familiar with the exact numbers, but any of the research I've read on this particular philosophy shows that 70-ish or more % of people really respond to that extension. And I think part of it is that we live in a flexion-based world at this point in time. We're in our cars a lot. We're sit at desks a lot. If we sleep on our sides, we're usually flexed a little bit through the spine. So we might spend 8, 10, 12, 16 hours a day in a slightly rounded position without any real kind of pushback from that. We don't do anything intentionally to go the opposite direction. So a lot of times, this is where I start with almost all low back patients and even neck patients, is I try to put them into these positions that they're not necessarily accustomed to anymore. And more often than not, it at minimum, it helps reduce the pain fairly quickly. And it's our first treatment strategy for trying to get you through and over the hump of that acute level of pain that you have in those first couple of days of pain.
Okay. Yeah, I mean, it's not necessary. It could be that flexion's causing your pain. Cause I know there's a lot of, there's several golfers with us tonight who, back pain develops throughout the golf season. And I think that's probably a more of a rotation based thing just because that's the nature of the sport. But we can talk about that a little bit later. But I think it's important to be able to have some things that you can try at home that you can feel fairly confident with as sort of a self-treatment, things that are relatively safe. So is that prone extension in that category?
It is, yeah, absolutely. I think the prone extension actually puts a little bit more pressure on the spine than the standing back bend. And a lot of times, especially early in a back pain episode, the standing back bend it's a little bit more weight from your upper body through some structures that are irritable. And I think the prone press up actually works better, especially early on.
And by prone press up, we're just talking about
it's that cobra pose, that hands in push up position while lying on your floor and bending backwards, holding for about 5 seconds, and then backing off completely. I could pull up a video here if you want me to. I can share my screen, or if you could share my screen.
I think the biggest thing we want to tackle is kind of what's happening with back pain,
Sure.
What's going on with back pain, and maybe getting a visual. So if the video is good for a visual of what's actually happening to cause the pain, that would be helpful.
No, it's just basically an exercise video to show you how to do what we're trying to teach. It's pretty simple. It's hard to go wrong. In the exception of someone who maybe has some shoulder pain that's flaring up as well if they're trying to do that push-up position and they're not fully comfortable with it.
Julie, did you have a question?
Yes, I have a question. So I can attest to the fact that the moving and everything that you've said is really, really helpful.
Mm-hmm.
I was wondering about sleeping. I've got the chronic pain. If I keep moving during the day and reduce the amount of sitting and everything, things are fairly decent during the day.
Mm-hmm.
But at night, I can take my couple of Tylenol and that's good for about 4 hours. And then, the rest of the night is pain, and I'm a side sleeper.
Mm-hmm.
And I just wondered if there's any advice on more comfortable sleeping positions for
Sure.
that.
Yes, sleep is one of the biggest questions we get just because it affects everyone. and pain generally affects sleep because we're busy throughout the day and we can kind of get through it. But then at night, we don't have as much to worry about. So our brain kind of gets a little bit more intently focused on what might be problematic. There's not a great expertise on pain and sleep. There's things you can certainly do to help with sleep. You can do normal sleep hygiene type things, no screen time before bed, doing light activity before bed, stretching before bed, maybe drinking some chamomile tea or some melatonin or things like that are proven to help with sleep. As far as positions, that's pretty individual because everyone's pain is a little bit differently. And what can happen is you've been sleeping in one position for a really long time of your life. So you just get so used to it that you have a hard time getting comfortable in other positions. You can always try propping pillows behind you. You can try a different sleeping position. It's a little bit more difficult in back pain rather than like shoulder pain to say prop up your shoulder in a certain direction or certain way that maybe feels a little bit better. But you're basically just trying to experiment within your own sleep cycle to say, is there a position that I can find that's a little bit better? Because everyone's pain is a little bit different. Sometimes if you have a soft bed versus more of a firm bed mattress, those things can certainly make a difference, but it's not something that I usually tell people to go out and spend a couple $1,000s on a new mattress trying to figure it out when that's usually not the sole reason for why someone is painful. If someone's got the means and has a 20-year-old mattress and they're ready to move on from it, it's certainly an option, but you don't think you need to run to make any significant purchases in that way, to try to make that difference. So sleep positions are pretty individual to everyone. You can always, some of the easier stuff, putting a pillow between the knees, trying different positions, propping yourself up where you're maybe on your side still, but there's a pillow behind your back, so you're not necessarily supporting your own weight. You're more rolled into the pillow on your backside than you are, say, fully on your side. So those are some things that I've seen in the past work fairly well. But again, it's hard to tell without seeing someone in front of me in the clinic to say, this position doesn't work for you, let's try something else.
Okay, thanks. Yeah, it was interesting to hear you say the, side sleeping, you do get some of that curving of the back, like,
Sure.
like sitting. So I hadn't thought of that. So, okay. I should try back sleeping. So sometime.
All right. Any other big questions currently?
Greg, let's talk about rotations and sort of what the mechanism is there, what's actually happening, and how we can maybe improve the situation.
Sure. Well, are we speaking of, say, the golf swing specifically?
I'm thinking of the golf swing, but I think it happens more than that.
Sure.
It's any rotational sport.
Absolutely. Hockey, baseball, anything that requires it. Sure. Yeah. So you said you have some golfers in the audience here tonight, so I'll speak to golf specifically, and you could double this for hockey to some degree. But a lot of us will rotate in areas that we don't need to rotate through. Essentially, especially if you're a golfer on the weekend and you sit at a desk during the week, your thoracic spine is going to get stiff at some point. And part of that golf swing is being able to rotate through your thoracic spine and rotate through your hips. And when you rotate through your thoracic spine and through your hips, you take pressure off of your low back. By spreading the motion across, say, 14 or 15 segments of your spine versus 5 segments of your spine or 3 segments of your spine, you're not putting all that rapid force through a very small condensed area, so your body can take the pressure a little bit more. So yeah, I was going to get to hip mobility and thoracic mobility at some point here, but I think there are two of the more important things with back pain is that if you're stiff in your hips and you're stiff in your thoracic spine, something's going to make up for it. And that thing that makes up for it is you usually move through those lowest segments of your lumbar spine, your L4-5 segment and your L5-S1 segment. And those are the segments of the low back that tend to see the most amounts of arthritis in them at younger ages. And they tend to be the disc that herniates in a larger percentage of the population, and especially in golf. That rotation in that flex position from a slight flex position to a slight extended position, it can be fairly detrimental. So trying to spread that force across more of your body into your hips and into your thoracic spine is pretty important.
So we see that a lot, Greg, where, and the idea is, you keep going with the golf swing. So with the golf swing, you have a certain range of motion that you need to get through for an effective swing. And a lot of times, if you lack the mobility in one spot, your body's going to take that rotation from another spot. And I don't know if you were going to touch on this, but the spine is built in a way where we have big vertebrae at the bottom, smaller vertebrae at the top, and from the bottom, you really only have a few degrees of rotation at each segment, and it gets more and more as you go up. So as we rotate, really the best, most effective way to rotate is from the head. So head, shoulders, and then maybe hips. And so I think if you start to lose some of that head and shoulder rotation, then you start to rotate early on the spine, and you're maybe rotating a joint that isn't made to rotate quite as much. So I think focusing and talking about the thoracic spine mobility and things like that, and the importance of that is a great way, and maybe ways to warm up.
Absolutely. Yeah, I find that stuff is best in the warm up in reality, because there's not a lot of exercises that are specifically going to try to strengthen into that thoracic rotation. We'll see it a little bit more in the hip rotation, or in a lot of cases, the anti-rotation of single leg exercises. So the warm up is a really great place to start to activate some of those thoracic rotation drills, hip mobility, hip rotation, things like that you don't necessarily always are super trainable in a group setting.
Would you be willing to throw together some of your like top 5 thoracic mobility warm-up drills for us? Not right now, but
Yeah,
as
absolutely.
a follow-up.
Yeah, I can do that. I'll put it together tonight or tomorrow morning and send it out to you, and you can send it out to everyone.
Okay, cool, thanks.
Yep.
So what do you say for people who, you know, and I think the biggest thing we hear is, you know, at the beginning of either beginning of the golf season or beginning of a round, and you could insert tennis, really anything here. Mm-hmm. They feel pretty good, but then as things go along, we start to deteriorate. What are some things, with it, not talking like swing mechanics or anything like that, or mm-hmm. whatever it might be, what are some things to think about if you start to feel that pain coming on? You know, what are some things we could focus on to make sure we maintain or stay pain-free, I guess, through the whole round?
Sure. That's a good question. How many people do a really good warm-up before their round? I know that I try to golf less often than I would like to, but I go out and I get on the course and I swing my leg a few times and I throw a few spins in there, and I hop up and try to hit a 300-yard drive on hole 1, which I think I did with you one time, if I'm not mistaken, down at Brookside. So not a lot of people, especially say amateur golfers, are going to go through a real solid warm-up. And it doesn't mean you need to go out into the range or hit 20 or 30 or 50 tennis balls or golf balls or slap shots before getting out there for competition. It just means you show up 20 minutes earlier, you do a good stretch of the hips, you do some kind of guided mobility of the thoracic spine pre-round, and hopefully that will alleviate some of the tightnesses that you have, especially going into those first few holes. I know when I play, I'm usually pretty stiff holes like 1 through 4, and then I loosen up for the next 9, and then by the end, I'm starting to get a little fatigued and my swing goes to heck anyways. Towards the end of the round, and there's not a lot I can do about it. But getting that good, decent warm-up pre-round, if you're able to take a few swings or hit a few balls or whatever prior to stepping up to the first hole, you're going to do yourself a huge favor in terms of being able to get through the round with less pain. If you do something within the round or within your activity that hurts while you're doing it, and you felt it happen, sometimes it's hard to, other than using your adrenaline to kind of get through whatever you're doing and then reassessing after the round and saying, what is going on here? If you're able to get through it, you're like I said, you're probably not going to hurt yourself severely or significantly if you move on through it a little bit, but maybe you back off your swing, you hit 3/4 speed, you hit 3/4 of a full swing or a tennis hit or a hockey shot or whatever the case may be. And you just kind of get through the round, and then you reassess that night or the following morning to see how you're feeling. But most of that, I guess the take home there is to do a better warm up than you're currently. Would be the best advice to get through some of those times where maybe it would be a little bit more difficult.
I want to ask one more question, and then actually Dory has a question here. Dory got her, is in the chat. So any things we can do at home when one side does not rotate as far as the other in terms of thoracic rotation?
Sure, absolutely. That's a good question. It's something we see quite a bit from athletes and desk workers and types of weird questions. It's certainly unilateral tightness or unilateral restrictions are pretty common in our clinic, and when you see someone. And that's because we never move in every direction all the time. We usually find habits. We wear a purse on one side of our body. Brian is a hockey player, me as an amateur athlete, do a lot of the same things all the time. So you swing in one direction or you take a shot in one direction, and if you're a tennis player or a baseball player, your right arm might have a little bit more mobility in one direction than the other direction. So to sum up, if you were in clinic, I would like to do a good assessment to see maybe what's stiff. Is it a joint stiffness or is it a muscle stiffness? The easy at-home answer would to be doing more mobility on one side than the other. So it doesn't have to be the same. You don't have to do 20 reps on each side, every single workout. Maybe you spend more of your session working on one side than the other. If you're restricted to the left, you work more on the left restriction and you kind of let the right side be. And you get more reps over the course of days or weeks or months, which should help lead to that restriction improving. And it may not ever be, say, perfect. That there are some situations where perfect probably just isn't going to happen, especially as we get older. Or, if you were a racket athlete or a throwing athlete, you may just never have the internal rotation that you might have had when you were younger because your arm has physically changed shape over the years. But in terms of like a spinal mobility deficit, I would say certainly do a little bit more mobility work to the direction that is problematic and less on the side that is not problematic.
Can I ask my rib question?
Sure.
So I'm a rower,
Mm-hmm.
and in the front of my rib cage, very bottom, I can see kind of a rib that seems to protrude more than any of the others. And a few years ago, in an X-ray, the bottom two ribs were kind of sagging outside of the joint area where it looked like they should be attached,
Sure.
And I think I've just lived like that for years. Does that affect my spinal stability at all? I mean, I feel it gets aggravated when I do sit-ups and some motions and sometimes rowing and stuff.
Yeah, absolutely. And there's even case studies of stress fractures in those bottom ribs, of people who are really slamming on those things repeatedly over years or periods of high training. But your rectus abdominis, or your six-pack abs, are going to connect directly to the bottom of that rib cage. So anything that uses those muscles could certainly maybe irritate those ribs if they're sore. Is it going to create a giant change in stability? It'll probably be a little bit more subtle than that, as opposed to this gross dramatic change. But if we think about your diaphragm as being the top of your core as well, breathing exercises, the diaphragm is going to attach to the backside or the underside of the first few of those ribs that are down towards the bottom. So breathing exercises may be able to help that as well. So using your diaphragm a little bit more appropriately while you're exercising, while you're doing the planks, while you're doing the crunches, sit-ups, whatever you're doing. So, to answer the question, yes, it could certainly be problematic. Is it going to be so problematic that you can't maintain core stability while doing your exercises? Probably not in the gym setting. It might be a little bit more problematic when you're in the boat and you're doing the rowing drills themselves.
I would say too, like the rib injuries are a big thing. You see a lot in rowing, right, Kelly? I mean, it's a pretty common thing, something you see a lot. So just when you have that kind of pressure built up inside, there is a lot of stuff that goes on there. But I think over time, like my crazy shoulder thing here where my collarbone sticks up like that, over time, it just, your body adapts to it and sort of finds a way to be healed, right? Finds a way to stabilize and to compensate without it. Now that might lead to some other things, but as far as stability, at this point, it might be, it might be sort of other things have come in to help out, but who knows for sure. Well, let's get wrapping up here. And I think, Greg, the one thing that I want to know is, if you're somebody who, let's say you get out of the car after 2 hours or 3 hours and it takes you 2 minutes to get standing up straight, right? You do the old man shuffle forward, and then eventually you can kind of get up into a straight up position. Talk a little bit about what has happened there and why that tightness is there, and if there's anything outside of getting out of the car every hour, if there's anything we can do about that.
Yeah, this happens to me all the time because my family and I, we drive 7 or 8 hours to Pennsylvania fairly routinely. But you get out of that rest stop and you're really stiff. And basically what happens is you've been sitting in this kind of flex posture, you've been a little bit slouched your tissues begin to creep. Your ligaments stretch a little bit, your muscles stretch a little bit. Your hip flexors have been in this shortened position for a period of time now. So you go to stand up straight, your hip flexors are stiff because they've been stuck in this shortened position. And then your spinal extensors and the ligaments that say, connect to one vertebrae to the next have been lengthened and stiff. So you basically get up and you have a really hard time standing. What I do in that situation is I try to go to some of those back bends. If I can get myself upright when I get into the rest stop and we sit down at a table, I'll do some hip stretches. So I'll try to get my hip flexors a bit stretched out because a lot of times we've been sitting for 3 or 4 hours straight. So I'm trying to get those hip flexors stretched out a bit. And then I'm trying to get myself a little bit more upright through my low back to where I'm doing those standing back bends while I'm standing around waiting for whatever it is at Starbucks or waiting for my kid to finally use the potty for the first time in an hour when he refuses. But doing those things, I think getting the front of the hips loosened up first makes it a little bit easier because then you're just taking a lot of pressure off your low back. Those hip flexor muscles attached directly to the spine. So when they are stiff and they've been in this short position for a long period of time, it makes sense to me to try to get those things a little bit more pliable or a little bit more long prior to trying to bend backwards.
Okay, so any other questions while we are, I want to respect Greg's time here, so I know we're getting close to wrapping up in the next 4 or 5 minutes. But let's, if you have any other questions, feel free to reach out or feel free to either type it in the chat or shout it out. Oh yeah, there's public stretchers all over the place, Julie. It's a thing. They're usually wearing some sort of like dry fit material.
And Lululemon.
And Lululemon. So if anybody has any last questions here, we can shout it out. Otherwise, I think the biggest takeaways are that, number one, for me, one of the biggest things is understanding that limitations in one part of your movement a lot of times will cause issues in a different part of your movement or a different part of your back. And so what was the other one? I had another one that was a good takeaway for me here. The extension, I think the extension exercises are big and a great way to start with any kind of self-diagnosis. And then I think the last one, the part about endurance, and you can't exactly just stop playing golf after 6 holes, but I mean, you could, it wouldn't be much fun. But I think those are
too much for it.
Yeah, that's true. They don't have a 6-hole package up front. Julie asked, any cautions related to the Theragun?
The biggest thing I see with Theragun is just keep it into soft tissue locations, keep it into the muscles. You're not going to do anything for yourself if you're like pushing it into your kneecap or into a spinous process of your spine. So try to keep it in things that feel a bit softer. And if you get the gun onto something that feels hard, you don't need to kind of keep pushing there, but otherwise not particularly. I feel like they're pretty good. A good thing for self work. Okay.
So maybe Greg, Alyssa had asked, what's the best way to stretch the hip flexors? Alyssa, I'm happy to answer that. I'll put my email in here too. But Greg, if you maybe throw, top five stretches to help with back pain, that would be awesome. Something we could send out to the folks.
Sure. Let me just make a note of that and I'll get it to you in the morning. Okay. If that's okay with you.
I'm putting you on the spot here, and I'm doing with everyone watching, so you have to do it. At the risk of jeopardizing our friendship.
Sure.
Okay. Well, Greg, thank you so much for this. If there's any last questions or concerns or anything like that, we have about 1 minute left, but Greg's email is in there. It's worked its way a bit up in the chat. groskovensky@med.umich.edu. And there it is again. Good job. Yeah, feel free to reach out to Greg. Feel free to reach out to me if you have any questions about this stuff. Certainly, I've learned a lot from Greg, and we put a lot of what I've learned from him into our programming. So you can thank Greg if you're having success with your back pain, and if you're not having success with your back pain, you can go see Greg because he is better than I am.
I'm available.
Great endorsement. He's available and he's better than you are. Wow.
Yeah, I mean, how does that work? Something's up.
Thanks so much, Greg.
Yeah, thank you, and thank you all for taking a bit of time to join us. If you have, again, I want this to be really valuable for you. So if you have some questions that went unanswered, please reach out to either Greg or myself, and we will help you out. Or if you have everybody has a specific reason they joined tonight. And I think, I'm pretty sure Greg's frozen smile. Oh, he's back. I know his battery is running low. So, oh, that's an awesome screenshot. If you have questions, that everybody came here with a specific question. So if that went unanswered today, if you would like to know more about it, please reach out to one of us, and we'll help you out. So thanks again for joining. We got a lot of value out of this, and enjoy the rest of your evening. Greg, thank you. Are you back? You're back.
I am. Yeah. Sorry about that. My laptop died and I popped it up on my phone real quick.
Okay. Well, we're just wrapping up. So thank you so much for your time, and always love hearing from you. So we'll definitely do this maybe in the next, I don't know, 6 months or so. We'll have you back on.
We can do it.
Okay.
Thanks, Greg.
Have a
Thanks,
great
Brian.
night.
Thank you.
Thank
So long.
All right. Thanks, man.